My name is Soufer, and I'm an imaging specialist at the Chattanooga Heart Institute. I decided to become a doctor because I've always been interested in the sciences and the humanities, and I found that rather than just sort of sitting at a lab bench all day doing research, I wanted to be involved with people and really help people. And as time went on, I realized that's what really makes me tick. And I just love human interactions, but I love the science behind medicine and treating people with those tools that I've developed and explaining those sort of complicated medical situations to people in terms they can understand is something that I really love. I've always had an intuitive understanding of the physiology or the way that the heart interacts with the rest of the organ systems of the body. And it's just something that I've always loved thinking about and solving the problems behind the heart and how it functions. And when I got into medicine, my training in medicine, I always loved taking care of patients with heart issues and found that it really drove me. So I'm a cardiac imaging specialist. That means that I read images of people's hearts. I did extra training to learn how to read not just the traditional cardiac imaging scans of echoes, ultrasounds of the heart, and stress tests, but I also learned how to read cardiac CAT scans and cardiac MRIs. I think it was really valuable to take that extra time in my training to learn all of those skills, and by doing that I can think about what is the best test to solve your problem as my patient, and I can really break it down and be particular about which test I order. When I get a report about a particular test, even one that I didn't read, I know exactly what that test can show and what the limitations are of that study. So I think it's a very valuable tool to help me decide whether or not my patient has a certain diagnosis and if there are any further tests that I need to send them for in order to figure their situation out. I chose to work at the Chattanooga Heart Institute because I was extraordinarily impressed with all the doctors here and the facilities and the Memorial Hospital in general. It's just a really nice place to work. People are very friendly and compassionate. The doctors at the Chattanooga Heart Institute are some of the best in the country, and I felt honored to be able to come here to work. I also fell in love with the city of Chattanooga. My wife and I have really enjoyed raising our children here so far. I think patients, when they come to see me, can expect me to be present for them, not distracted by the other things that are going on during my day. When I'm in the room with the patient, I'm there with them, I'm there to listen, and I'm there to try to figure out how to best improve their health and figure out whatever problem that they may have with their heart. They can also expect that I will break things down for them honestly and also explain it in a way that they can understand. I come to work every day because I think that I have the best job in the world. I am able to do exactly what I love doing. I'm able to be with people in moments where they're very vulnerable and real and have interactions with them that really affect their life. And it affects my life too in a positive way, to be able to help people and use the knowledge and skills that I've learned to do that. So I feel very blessed and fortunate to be able to do what I do.